I'm Faith Muchemwa, and I was here for 6 months, and I was doing it was part of my residency in Plastic and Reconstructive Surgery. The name of the fellowship was the Prakash Foundation. I think I was one of the first ones to be sponsored by this fellowship. I'm from Zimbabwe, and I'm registered with it's called the College of Surgeons, East, Central and Southern Africa, which is called COSEXA. It's a regional college in Africa. Surgery is the one specialty that gives immediate results. You know, someone comes with, for example, a cleft lip. They come out of surgery, they are normal. You know, it's different from medicine where you have to give medicines, you wait for 2 weeks, 3 weeks for it to work. So surgery gives immediate results, and I like that. I'm not a very patient person, I want results. So currently in Zimbabwe there are only 2 practicing plastic surgeons. And when I say plastic surgery, the normal thought would be cosmetic surgery. But it's a big field. There's a lot of reconstructive surgery that we do. We treat congenital anomalies, we treat emergencies like burns and all that. But we don't have the numbers, we don't have enough surgeons to do that. So it's really in high demand right now. So I think I'll make a better impact there than anywhere else. I am the only female plastic surgery trainee in Zimbabwe. After coming here, I realized why it's so important, because you get exposed to different kinds of thinking. You get exposed to different ways of doing things. And I thought that what I learned here, like when I went back home, I changed my practice. You know, the way at home in Zimbabwe, I'm just talking about Zimbabwe. Patients come, you are the doctor, it's sort of paternalistic kind of. You tell them what you want to tell them. If they want, usually they don't even ask you any questions. You know, they say, oh, thank you, doctor. They accept whatever you say. But when I came here, I realized that I actually had to read a lot. I had to explain to patients because they came with general knowledge, you know, about their condition. And when I went home, I do that a lot now, and I think patients appreciate that information better than before, when I just used to tell them, you know, just in brief, this is what I'm going to do to you, these are the possible complications, very briefly. I think the AK Prakash Foundation is for like surgical trainees in low resource settings to come here, study surgery, and then I think the main mandate is that these trainees should go back to their home country and train other people. I think that's the major mandate, and improve healthcare systems in those countries. For me personally, I think that I will make a greater impact working at home than, for example, migrating to come here, because I think the need for plastic surgery in Zimbabwe is much, much greater than it is here. So because of my exposure, and you know, now I know a lot about what's needed for what procedures, and I think that has helped the hospital. I definitely hope that there will be more female surgical trainees, and I'm trying actually to be a mentor, or you know, to female medical students. They enjoy watching a woman operate, and I hope that they will try and emulate that and become surgeons themselves. Firstly, I would like to thank the Prakash Foundation for doing this. This initiative is really great, and it will go a long way in improving healthcare services in those countries. Grateful itself is not a good enough word, or it's not heavy enough to thank him, because it was actually my first time in North America, and without that, I don't know how else I could have even been here. So I'm very thankful and grateful.